Hello everybody, today we'll be talking about Bell's palsy. Now before we're going to start Bell's palsy, just pause the video and try answering these four questions that which side of the face is affected and what kind of lesion is it? Is it a right upper motor, right lower motor, left upper motor or left lower motor facial nerve palsy? So let's get started and we'll be back in a few minutes. So Bell's palsy, it is an acute paralysis or weakness of the seventh cranial nerves or facial nerve without any identifiable cause. And that is first described by Sir Charles Bell. Accordingly, the Bell's palsy was named. So here we have the motor cortex represented in red color, and if we take coronal sections of the brain and look at this motor cortex, these are going to give rise to upper motor neurons which will then innervate the facial nerve nuclei that is present in the brainstem. So we have midbrain, pons and medulla, and the facial nuclei are present at the lower pons. Now this facial nuclei is arbitrarily divided into upper facial nuclei and lower facial nuclei. The upper facial nuclei is going to supply the ipsilateral upper hemiface and the lower facial nuclei is going to supply the ipsilateral lower hemiface. So the upper facial nerve nuclei is getting contralateral and ipsilateral innervation from the cerebral cortex, where the lower facial nuclei is only innervated by the contralateral cerebral cortex. So if you zoom it and you will see that the upper nuclei has got bilateral innervation from both the cortex, but only contralateral cortex will innervate the lower facial nuclei. If there is upper motor neuron lesion at this region, then the contralateral lower face will be affected. The contralateral upper face will not be affected, it will be spared because it is still getting innervation from the ipsilateral cerebral cortex, because I told you the upper facial nerve nuclei has bilateral innervation. Here the patient is unable to smile as well as unable to blow, that means unable to whistle because of the palsy of buccinator muscle. Also the patient has loss of nasolabial fold, but characteristically as the upper hemiface is spared, so can raise both the eyebrows, that is frowning is present. But in lower motor neuron lesion, ipsilateral, please mark my word, ipsilateral hemiface is affected, that means both upper and lower hemifacial palsy is there. So there will be every features but added on that the patient cannot raise the eyebrows, so patient can't frown because of the palsy of frontalis and corrugator superciliaris. So here we are back with our diagrams. So now case 1, here the patient's mouth is deviated to the right side, that means the right sided muscles are working, and palsy on the left side. The palsy is on the left side. Now you have to know whether it is upper motor or lower motor. Look at the eyebrow. This eyebrow, patient cannot elevate the left sided eyebrow. That means pura ka pura left sided hemiface is affected. So it's a left sided lower motor neuron palsy. Coming to the case 3, here also you see that the mouth is deviated, angle of mouth is deviated to the left side, and also that means the left side is working, so right side is palsy. Right side is the palsy side. Now here also you can see that on the right side the patient cannot elevate the eyebrow, where can on the left side. That means again it is a lower motor neuron, because the right sided pura hemiface is gone and lower motor neuron is ipsilateral. That means it's a right sided lower motor neuron palsy. So case 1 and 3 are opposite. So let us discuss case 2 and case 4. Here you can just simplify that the angle of mouth is deviated to the left side. That means right side is the site of palsy or weakness. Okay. Now if you see that patient can elevate the eyebrows. So that means the upper portion of this face is spared. This portion is spared. That means it is just the right lower face is involved. So right lower facial palsy. So is it upper motor or lower motor? That means it is your upper motor neuron. So if they ask you the site of lesion, that's where many of you make mistakes. It should be left upper motor neuron palsy. Okay. So it is right lower facial palsy, but the site of lesion will be contralateral. It will be left upper motor neuron palsy. Okay. Now here also you can see here angle of mouth is deviated to the right side. So obviously the left side is the palsy side. That means the left sided facial muscles are weak. Now you can see the patient can still elevate the upper portion of the face. Upper portion is spared. The upper portion is spared. That means only the lower half is involved. So here again it's a left lower facial palsy. So if they ask you the site of lesion, please remember it will be the contralateral. That means it's a right-sided upper motor neuron palsy. So understanding. So the take-home point from here, if it is upper motor neuron, the site of lesion will be always contralateral to the site of facial palsy or weakness. If it is lower motor neuron, obviously lower motor neuron means below the level of pons. Okay, that means the side of lesion will be always ipsilateral. Always ipsilateral. Okay. So this is all. Thank you.